When David Aldheiser was born with life-threatening abnormalities 4 years ago, doctors did not expect him to survive. Now, his extensive medical conditions require constant care. Medicaid is how he's been able to live at home in North Carolina under his mother's care. That could change, though, because of how President Trump's big, beautiful bill is shifting how federal funding is spent across the country. And according to David's mother, Rachel, North Carolina state legislators have already chosen not to fully fund the state's Medicaid program for the upcoming fiscal year. Rachel Roth Aldheiser joins us now. In addition to being her son's caretaker, she's a writer and visiting fellow at the Ethics and Public Policy Center. Thanks for being here, Rachel. I appreciate your time.
Thanks so much for having me. I'm really grateful to be here.
You call yourself in the New York Times op-ed that you wrote about this a proud conservative, and that you're coming from from a conservative perspective, and you want to make that clear, I think, for obvious reasons. I want to ask you. You talk about how Medicaid is your village. Explain that to me.
Yeah, so I'd love to start just by sharing a bit about my son, David. He was born, as you said, with a set of life-threatening congenital abnormalities. I'm so proud and grateful to be David's mom. But caring for David is challenging in a way that is difficult to describe unless you've also cared for a profoundly disabled child 24 hours a day, 7 days a week for 4 years. We require a village in order to make David's life work. David's extensive medical conditions mean that he actually meets the criteria for institutional level care, health care. And thanks to this Medicaid program, we're actually able to provide that care in our very home. That is not work that my husband and I could ever possibly do alone. Nothing has humbled me quite like parenting a profoundly disabled child, because the gap between what I can provide as a parent and between what David needs is insurmountable. Thanks to Medicaid, it fills that gap. You
don't have a way to do this without that Medicaid funding?
Absolutely not. David is one of 3,700 children living with profound disabilities in North Carolina. Thousands of other children like David exist all across our country. These children rely on these optional Medicaid waivers called community and home-based service waivers that give children like David an opportunity to live at home where they belong with their families instead of spend their lives in a medical institution.
There was talk that the funding for Medicaid wouldn't affect programs like yours. But you say that's not true.
I think there's a lot that's remain to be seen about how exactly federal cuts will impact programs like David. But what I can tell you on the ground in North Carolina, what's happening right now is that our Republican-held state legislature is voluntarily reducing our Medicaid budget by $319 million. Because state Medicaid programs operate on a matching basis, that means the real reduction there is around $1 billion. Families like mine are scared. We're worried. We're concerned. How are we going to be able to care for our children? They desperately need these services. We're worried about providers leaving the Medicaid program, our children being able to access life-enhancing services. Yeah, we're concerned all across the board.
You know, programs like mine are airing all over the Capitol right now, could be airing inside the White House at this moment. It's been known to happen. If you want to get a message to President Trump directly, what is that message?
You know, my son is not a Republican or a Democrat. He's just an American citizen who's extremely vulnerable. He needs the support of each of our dollars, a little bit of that dollar going to support his life. Medicaid makes David's life possible. I'm extremely grateful to the Medicaid program that David's enrolled in for allowing his quality of life to be what it is and for him to be at home in our family where he belongs.
You know, I should have started with this, and I'm sorry for not, but tell me a little bit more about what David has done for your life, what he brings to you every day.
I think each of us, has something that gets us up in the morning. What gets us going? For me, it's being a voice for my son. He's not able to talk, walk, eat independently. David needs maximal care for the rest of his life. I'm privileged to be able to provide that care for my son. I'm grateful that Medicaid sees the value in what I can give him. David's life has immense worth and value. And when a portion of your dollar goes to supporting children like David, you're participating in charity.
You write in the op-ed, and I'll read it, how we care for our most vulnerable reveals what we believe about ourselves. I'm just one mother and David is just one child, but this affects your neighbors. This affects you. At one point or another, most of us will lose independence, health, rationality, and will. Eventually, we will rely wholly on someone else to care for us. Dependence, weakness, need of others. These are features, not bugs, of the human experience. Really well put. Rachel Roth Aldheiser, thank you very, very much for joining us today.
Thank you, Katie.